The purpose of charity care is for every person to be healthy and to get the care that they need without being saddled with, unmanageable debt.
Pues nos preocupamos porque eran como, no recuerdo, $11,000 y alguien nos habló del abogado y fui muchas veces porque no daba con él. Ajá, porque como nosotros no nos gustan los problemas ni sabíamos, se nos daba miedo como si le preguntábamos al abogado, pero fuimos y gracias a Dios que él nos ayudó.
Maria and Roberto are typical of the immigrant farm workers who pick fruit in the fertile Wenatchee Valley of Washington State.
We're in central Washington. A huge number of people are farm workers, migrant and seasonal farm workers. And so that's a significant percentage of the charity care population in rural areas, and their life expectancy is 49 years.
Like other farm worker families, Maria, Roberto, and their children have no health insurance.
They came to us because they were sued. Mr. Caballero, he's in his 50s. He and his wife still have children, so he's working and supporting a family, and he had a stroke. After that, he needed physical therapy. His recovery took quite a bit of time, and he tried to apply for charity care, and when he did, he was told he was too late.
Farm worker families like the Caballeros have no safety net.
The law says that if you're at 100% of the federal poverty income guidelines or below, you should get free care.
The Caballeros' stress was compounded by the multiple attempts by the local hospital to collect on their debt after her husband's charity care application was denied.
One night, he and his wife and his 2 children were home, and there was a knock on the door, and there was a police officer. And he was served with a summons and complaint, and he just didn't know what the documents were. They were written in English. He didn't read English. His wife didn't read English, so he had to give the papers to his children to find out what the paperwork meant.
Longtime social justice attorney and farm worker advocate Ty Duhamel took the Caballeros case.
And he had to go to court. He had 20 days to respond to the pleadings, and he didn't know how, so he came to legal services for help.
Having the father of the household incapacitated was an enormous problem for this family. Without sick pay or health insurance, the burden of providing for the family fell upon Maria.
Pues no trabajaba, como le digo, yo siempre me gusta cocinar y vendía comida. Sí trabajé como hasta enero, febrero, como 4 meses dejé de no para cuidar.
Farm workers like Maria and Roberto also tend to have more health issues than people with more reliable paychecks and access to health insurance.
And the hospital had made a mistake. They should have accepted his application for charity care. And if they had, they would have found him eligible, and he wouldn't have had to pay the bill at all.
Complicating an already stressful situation, the Caballeros rely on their children to help interpret for them.
Pero cuando fuimos a ver al abogado, ellos nos acompañaron los dos. Porque como la niña pues ya está grande, nomás que le da vergüenza salir porque es bien vergonzosa. Pero ella pues ella habla bien español y inglés, y dijimos, por si no hay quien hable español, sí. Es triste, y son experiencias que la vida nos da. Pero si Dios nuestro Señor así quiere, lo tenemos que aceptar.
In the face of overwhelming debt, the family considered their options. Returning to Mexico was out of the question. The Caballeros are committed to supporting their children's education in the United States.
Ellos están estudiados aquí, y yo le dije, ¿qué vamos a hacer a México si ellos no saben nada de allá? Y yo digo, ¿cómo va a ir a la escuela? No va a saber, se me van a atrasar. Y yo miro como que mi hija, ella se quiere estudiar, y yo digo, pues la voy a atrasar hasta atrás.
Not uncommon for farm worker communities, the community rallied around the Caballeros. During the worst of the couple's illnesses, others in the community answered their material needs.
Nos ayudaron los compañeros de trabajo. Cuando él se enfermó me dieron $500, pero cuando yo me enfermé a mí me ayudaban, cada quincena me daban $300, $200. Y muchas personas nos traían comida o cosas para los niños. Porque como nos juntamos los dos enfermos, pues no podíamos trabajar, pero muchas personas nos ayudaron.
We appeared in court, contacted the collection agency that sued him. We worked out a settlement with the collection agency because they knew what the law is as well. And they not only wrote off the hospital bill that the family couldn't afford to pay because they were indigent, but all the interest, hundreds of dollars of interest and hundreds of dollars of court fees and attorney's fees were all written off as well. And this is a very common problem. We see it a lot.
Attorneys for Columbia Legal Services work with farm worker families like the Caballeros all over the state. The family has learned that they are not alone in dealing with their medical and financial issues and would advise other families to take action if they find themselves in a similar situation.
Pues que no se asusten como nosotros y que busquen ayuda, que sí la hay, que visiten Servicios Colombia. Pues que no tengan miedo más que nada como nosotros, que hay personas de buenos sentimientos que sí nos ayudan por